What are the odds of the daughter of a British couple with horrible teeth ending up in dentistry and changing the game so that you can be empowered to enjoy beautiful teeth? How do you know if your oral care routine is working, the things you do every day? The American Dental Association make it clear that we're supposed to brush and floss and not eat too much sugar and go for regular dental cleanings. I think almost everybody has heard that at some point in a school class or from their parents or from their dentist office themselves. Will that care last you and protect your teeth and your gums for the rest of your life? We see about 10% of the population during their early adult life having so-called healthy teeth, and we're going to talk about what is a healthy mouth. But when you get to looking at the population in the age range of 60, 65 and older, most retired adults in America have dental issues. They've either got a lot of fillings being refilled, they're having root canals and crowns, they may have teeth being extracted for implants, and worse than that, when they get to the end of all that work, chances are they're going to be told that they have a gum problem and they now need to go for cleanings more often, more regularly, and deeper and more expensive. So you can't tell me that the advice to brush and floss and have regular cleanings is helping the majority of people. 97% of seniors end up in this abyss of dental expenses and dental disease. The thing is, how do you know which other treatment you should use? And in order to evaluate this, I would say, let's look at how do you decide, for example, which diet to follow. You know the doctors that say you shouldn't eat legume because of the lectins. No, you should be on a carnivore diet, or you should be doing a keto diet, and everybody's got their own philosophy. The problem with that is it's really difficult to see the long-term outcome. And it's really difficult to monitor much beyond maybe a 6 months to a couple of years on a particular diet, because you don't know the negative effects. And that is the difficulty. So how do you learn? Who do you trust? There are all these different opinions out there. People tell you coffee is bad. People tell you coffee is good. So with diet, myself, I believe it makes sense that whole foods, real foods, healthy foods, organic foods are worth choosing. Which ones you eat, probably the best thing to do is have variety. And then to learn more, I believe there are doctors, and one of my favorites is Dr. William Lee, because he explains things. He explains why green tea is a healthy drink. He explains why combining green tea with milk may change the health benefits. And these are the things that we need to look at in our own lives. It isn't enough to just say tea is good or tea is bad. Maybe it's how we drink it. Maybe it's the timing of how we drink it. Lots of small subtleties. So I look for people who are literally teachers. They teach you the science behind why they make recommendations. And I think that's a very important thing to do with dentistry as well. And that is one of the reasons I love doing what I do, writing books, doing videos, to try to explain to people that there's way more to oral health than simply to think you can just brush and floss your teeth and that's enough to protect them. Outcomes that you're looking for in oral health would be, how do your teeth appear? What happens to them? What is happening to your mouth? Do your teeth feel fragile? Do they break? Are they weak? If that's the case, something is wrong with the way you care for them. You may be simply using bad products, or you may be sipping and nibbling throughout the day, and that can certainly weaken your teeth. The other thing that you may be suffering is maybe you have cavities, maybe your fillings are falling out. Similar kind of problem. It may be your snacking, sipping habits or what you're sipping on that is the problem. And then if you have gum swelling or bleeding, that could be a simple problem that you're just cleaning your teeth the wrong way or the wrong time of day, or you're using tools like a dirty toothbrush, or you're storing it in the wrong way so it's becoming infected. There are these little patterns that make a difference. And it is the detail that you repeat day after day that can lead you down this very unfortunate road of dental disease. The outcome of your dental care should be that your teeth feel strong, that they are shiny and smooth. When you run your tongue over your teeth, they should feel terrific. You should wake up in the morning, no film in your mouth, no stuff on your tongue. You should be almost not sure if you've just cleaned your teeth or not. Your teeth should always feel this good. And then when you've finished eating and drinking, you shouldn't get a lot of food stuck in your teeth and all over the place. That would indicate that you have gum pocketing possibly, or that your teeth are not smooth and shiny, which again would indicate maybe you're using the wrong products. So there are these ways to look at the outcomes. How are you doing? And then if you're not doing well, how do you choose what to do? And as I say, the most important thing I believe you can do is learn, empower yourself. How do teeth get stronger? Is it possible to repair a cavity? Can you reverse gum disease? Because if you look online, if you think you're a researcher and you look online, be very careful. Because there are things being said online that are not true today. And it's not that maybe people are being mean, it's just that the knowledge hasn't yet percolated through to the internet. For example, I argue with people a lot about the fact that gums can regrow. They do. But you have to stop flossing. You have to brush differently with a different kind of toothbrush. And there are reasons why you have to do this, because you have to stimulate lymphatic flow, you have to stimulate circulation, you have to find a way to signal to stem cells to repair your gum tissues. That is new technology, that is a new thought pattern. You can find innovations now where they are regrowing gums with stem cells and lasers, but you can also do this yourself with the techniques that I teach. But when people argue with me, telling me that you cannot reverse gum disease, they are living in the past. It's very similar when people say to me, you've got to use floss. There are hygienists who are absolutely adamant that there is no other way than to floss your teeth. Back in the day, in the late 1800s, early 1900s, when dentistry was becoming a profession, they were looking at teeth and noticing that gum disease and cavities were associated with a film that was building up on the surface of teeth. That is something that today we call plaque. Well, what they didn't know back then, but what we know now, is that these plaque bacteria are actually floating in the liquids of our mouth. They go everywhere. They go up into the back of our nose, they go down our throats, they go into every little nook and cranny around our teeth. These bacteria are carried in saliva. And they didn't know that then. They didn't even think about saliva. They were simply looking at the surfaces of teeth, and they believed that if you could clean all this plaque off teeth, you wouldn't get gum disease and you wouldn't get cavities. And that is correct. But the problem with brushing and flossing is that the minute, even a professional cleaning, the minute you have cleaned the surface of your teeth, guess what happens? Next thing you know, your saliva is coating that clean tooth, bringing more plaque bacteria to regrow, to repeat the process. So this is why I recommend, instead of flossing, that you work in a regimented, orderly routine using xylitol, which is a sugar from birch trees that we know if you have a tiny little bit, 1 or 2 grams at the end of meals, it feeds the good bacteria in your mouth. And of course, back then they had no idea there were good bacteria in the mouth. Xylitol will feed these good bacteria and will make plaque, the film on teeth, slippery. And also, the most important thing about xylitol, it will also address the bacteria in your saliva. And what happens when we measure people who eat xylitol regularly, and they do it month after month after month, the first month they will clean the surface of their teeth. But after 6 months, simply having these small amounts of xylitol at the end of meals and throughout the day, to a total of about 5 to 10 grams per day, they don't get new plaque forming on their teeth. If you have no plaque forming on your teeth, then maybe you don't need to floss. This is why I don't simply say don't floss. I say use the routines and the strategies that I recommend. And the reason that I know my system works goes back to how I formulated it in the first place. My mother was told to have all her teeth taken out. She was 45 years old. And I happened to be working in a hospital, in a dental school, where we were learning that early loss of teeth in women, they were doing studies in a convent, and these nuns, the earlier they lost their teeth, the higher their risk for early onset dementia, which actually was a problem in my family. I knew she couldn't go to the dentist and have surgeries because I had already done those surgeries at dental school, and I knew they didn't work. They maybe helped for a little bit, but the long term was still the loss of teeth. So I told my mother, let's try something completely different. And she was ready to do this, and she did. And she saved those teeth, and from 45 to the age of 95, 50 years, she basically used my complete mouth care system, put most of the people in Fort Myers, Florida on my system, and till the day she died, had minimal dental treatments and retained her teeth. The same number of teeth as she had when she was 45 years old. So we basically stopped the progression of the damage to her mouth. Well, of course, I started using the system for myself and was advising patients in my office, so I also saw them. But for myself, I decided I would see if I could extend the interval between dental cleanings. And that's what I did. I used my system, I used my strategies, and then year after year I would be evaluated. But I didn't have a dental cleaning because I didn't have plaque. And what I have discovered after 40 years is that if you have no plaque and if you are using a system that is adequately protecting and healing and keeping your mouth healthy and balanced, then dental cleanings become less and less necessary. This is I was the second generation to experience, now in later life, no dental problems. My teeth feel comfortable. I haven't needed a filling since I was at dental school. And those fillings were put in childhood, so I haven't had this repetitious need for ongoing fillings. I have white ones, I have silver ones, I have, I have everything in my mouth, but it hasn't been changed since dental school. And this is health. When you don't need your fillings replaced, your teeth feel comfortable, they feel good every morning. My gums are healthy. I have taken oral DNA. This is a saliva test that you can see the bad bacteria in your mouth. I've also had testing to see the good bacteria in my mouth. And this is how, at this point, the best guide we have to whether or not a system is working. I, of course, taught my children. They have experienced a similar thing, and friends and circles of friends. And what's more now, grandchildren who are entering teenage, never having had a cavity, never having had a filling, never having had a sealant, having virtually no dental work whatsoever. And if that is the outcome you want, I believe, after 4 generations of my family, from a family history, this is what you have to realize, not only being British, but having a family history. My father had all his teeth taken out at 35, with periodontal disease, and my mother was 45 when she had hers out. And so it wasn't inherited good teeth. It was a system, I believe, that is able to protect teeth year after year after year.